Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a gastroenterology nurse practitioner for the past 6 years, and before that, I was a nurse in the endoscopy department for 15 years. I love gastroenterology, and I'm so glad you could join me today. We're going to be discussing Barrett's esophagus. This is something that is diagnosed by your endoscopist or your GI provider. Usually it is seen with people who have chronic reflux symptoms. It is actually caused from acid coming up into the bottom of the esophagus and causing the cells to change. What they do is the esophageal cells are very thin. Their squamous cells are kind of flat. So if the acid's coming up there, it really damages them. It'll hurt them. So it's almost your body's defense mechanism, and it causes those cells to change into small intestine cells, columnar cells. So they're a little bigger, and it's kind of protection against all that acid coming back up, which you're like, yay, way to go, body, you're helping me out. But cells should not change like that. And so we get concerned when we're like, hey, look, there's a different cell here that shouldn't be here. It's not an esophageal cell anymore. And so that's essentially what Barrett's esophagus is. It is intestinal cells found in the lower part of the esophagus. So what are some risk factors for Barrett's? Am I at risk or are you at risk? Well, people who have chronic reflux disease, people who are having heartburn frequently or any trouble swallowing, or they're feeling acid come up, that could that already kind of puts you at a risk, especially if you're taking medicine for it and you don't feel like it's working. Men, I'm sorry to tell you, you are at higher risk than women overall. If you are white, you are at higher risk. There's definitely been seen a higher risk in over African Americans. In fact, they're the lowest risk. Whites are still higher over Asians and Hispanics also. If you are overweight, that can increase your risk. If you smoke, that definitely increases your risk. Family history of Barrett's esophagus or esophageal cancer may increase your risk, but that's not seen as often. How do we know if you have Barrett's esophagus? So you undergo what's called an upper endoscopy. That's where we give you some sedation. And while you're asleep, we take a tiny little scope with a light on the end. When we pass it from the mouth down the esophagus, we still look in the stomach also. But in the bottom part of the esophagus, that's where your endoscopist is going to be able to see it. Usually you'll see a little change in the cells there also. They can see it visually, but specifically they're going to take very small biopsies there. And when I say biopsy, I mean small, like the size of a tip of a ballpoint pen. You're not going to feel it and it's not going to be painful. But they're going to take these biopsies and they're going to send it over to the pathologist who's going to look at it under the microscope. And they'll be able to say, oh, yep, that looks like intestinal metaplasia. That's Barrett's esophagus. Most Barrett's esophagus that we see is Barrett's without dysplasia, meaning the cells are still very clearly noted to be intestinal cells. If you have Barrett's esophagus without dysplasia, there are some things that should be done. Your doctor or your nurse practitioner will start you on a medication to help reduce the stomach acid. Usually it's a proton pump inhibitor like Protonix, Nexium, Prilosec, Dexilant, something like that. You'll need to take it every day indefinitely. And this is guidelines. These are what we know that help reduce the acid from coming up into the esophagus and causing it to worsen. The goal is to prevent it from changing or worsening, and also to stop the reflux symptoms. Often you will need to come back in for surveillance upper endoscopies. Sometimes people will come in a year after their first diagnosis just to get another good look. And then after that, surveillance is usually every 3 to 5 years. When I say surveillance, that means you come back in for an upper endoscopy and they take little biopsies again. There are some people who the Barrett's is more advanced and may have low-grade dysplasia. These people will have different treatments. It's no longer, hey, take this medication. It would be something that they would undergo a therapeutic intervention. One of them we use in our office, and it's done actually at the hospital endoscopy, is ablation, where they actually have a special machine that will burn off that area of Barrett's, and it's had really great success. Other people have undergone cryotherapy where it's freezing it. We used to use a photodynamic therapy, which isn't done as often as anymore. And that's definitely a treatment, and oftentimes it will completely eradicate Barrett's, but then they still come back in for their surveillance upper endoscopies. And then people with high grade dysplasia, that is now where we're sending you for treatment for, it's on the edge of esophageal cancer. And so that treatment is a little more advanced. So Barrett's esophagus is considered precancerous, even though without dysplasia, just because we see those cells changing. The risk of your risk to esophageal cancer increases by about 0.5% annually. So that is why it's important to get this checked out. It's not something that you should be afraid of or worrying, oh my goodness, I'm going to get esophageal cancer. No, we want to definitely diagnose it and we can manage it. And that's really what this is about. So if you are somebody who you feel like you're having a lot of reflux symptoms, if you're concerned, if you have family history, if you have any difficulty swallowing, anything like that, please talk to your healthcare provider, see your gastroenterologist. We would love to help you. Again, if you would like to, are there other topics that you would like me to touch on, to discuss? If you have questions, comments, please let me know. Feel free to like and subscribe. And thank you for joining me today. I definitely want you to be informed, educated, and remember, you're not alone.